I'm Jason Warrelmann, Director of Healthcare at UiPath, and I'm here at HIMSS 2021, bringing you a lot of live content and daily point of views from our customers and our valued partners. And today I actually invited one of our more niche partners, very focused in driving innovation in healthcare, Joe Nieto from Element Blue. Director of Customer Engagement.
That's absolutely right.
Thank you so much for joining us today. It's a very unique role. You don't see that too much outside of the software companies.
That's
so
right.
maybe a little bit of Element Blue and a little bit of what you do.
Sure, I'm a Director of Customer Engagement. And as you said, it is kind of a unique role in that we position myself as after the sales process going, which is all the RFP and all the presentations have been done, but right before you really start engaging with the customer, and that's where the focus is. Because healthcare, as opposed to some of the other industries that we work with, has some unique challenges. We're taking folks that are usually working from a clinical or a medical perspective and introducing this new technology called RPA. And so we have a standard process that we work with, like the Center of Excellence that you kind of know about, and then start really building that organization through there.
So one of the interesting things, Joe, pertaining to your role, I think you're right about adoption, right? And having a lot of conversations. I actually got a chance to meet with the Texas chapter of HIMSS last night. So we'll call out to the Texas chapter. A lot of organizations are adopting automation and are using automation. And of course, a lot of the questions were, how do you scale? How do I find my use cases? I'm trying to get it into more clinical business units, because to be fair, a lot of times it doesn't start there.
Right.
And they're trying to find direction. They're trying to find way. And of course, there's a big financial way of doing this. We talk about blueprints and self-funding roadmaps. It's still software that has a value at the end of the day.
Right.
You can't just hire people without having a justification, right?
Exactly.
Same thing with digital workers. But from your perspective, and especially seeing in the market, I mean, what has been the big challenge, and how are you overcoming it, especially with your role?
Sure. Some of the biggest challenges is getting to that aha moment with our customers. And hospitals have many, it's a hospital, they have all these clinics and all those departments, and once you get one started, word spreads around, and they kind of come in. What does automation mean? And the best example that I got was from one of my customers, and the way that she describes automation, I was like, yeah, I kind of get this. And she goes, imagine if you're at your desk and you want a Starbucks coffee. You could have a bot that says, hey, I want a Starbucks coffee, and the bot knows your preferences. It has your credit card information. It knows you like Starbucks, knows where you are. So we can go to the website, fill out exactly how you want your coffee, all the little things that you wanted, extra cream, order it at the location that's downstairs at the hospital, and then tell you when it's going to be ready, and it'll pop up a message. And somebody will go, well, gee, I like that. Yeah. Now imagine that across the board with everything from, I have a nurse that walks the floor, and every once in a while she's got to go out there and look for an authorization from an insurance company that says, Joe Nieto is staying here for 3 nights, but the doctor said I need a couple more. She's got to take time from her walking around to go a terminal, look things up, look up their insurance, and go, yeah, it's been approved, so I can fill out all my paperwork. And that, when you look at it from perspective, why is she doing that? She went to all these, medical school and everything to sit there in front of a computer and fill out forms. So those are the kind of things that we look at, and we're making great strides on the clinical space, talking about those kind of things. How do we give more time back between the physician and the patient? Because patient care is one of the critical measurements that hospitals look at.
No, excellent. And it's interesting as going and walking the floor here at HIMSS, single app technology companies, and with the future of work, it's really what they're focused on, right?
That's exactly
I want
right.
to give back the time to the clinician, the physician. Prior to the pandemic, still 20-25% deficit in clinicians.
Oh yeah.
Through the pandemic and even now, it's even worse. And it's just not clinicians, it's administrators, it's
Oh,
nurses,
absolutely.
it's all the people that actually deliver quality of care. And I think also people forget that the operational folks, especially people that drive nutrition, people that are making the beds, there's a deficit on those talents as well.
Absolutely.
So right now you're just talking about clinicians, but we talk about the future of work. You know, when we walked the floor, we saw a lot of pointed solutions focused on one element
That's right.
of driving the future of work. So when you go into the health system and you're working with them as an engagement leader, how do you help them navigate the story of pointed solution versus using a platform like automation, which they already have, to try to achieve the same outcomes?
That's one of the biggest discussions that we have, because the big driver for the hospitals is, of course, you know, there's a saying, if there's no margin, there's no mission. And so the mission, of course, is taking care of the patient, but they have to watch their nickels and their dimes just like everybody else.
Yeah.
And so when we come in and we say, you know, we've got a platform that'll do that for you. Oh, I didn't know. Yes, absolutely. And here's how it works. You know, and so you're not necessarily having to go and invest in a lot of these different pointed things that you were saying, because we can do a lot of that lift for you.
You know, when you're talking about lift and going and having these conversations and growing,
Yeah.
you know, especially talking to customers here who have come at HIMSS this year, I'm seeing a big difference of who is interested in this technology.
Absolutely.
A big difference in, I mean, it's HIMSS, so we see a lot of CTOs and CIOs, right? HFMEA, a lot of CFOs, of course, naturally, right? But when we bring in automation, especially in the health space, typically it's the CFO that picks it up first.
Right.
Now, chief technology officers and their teams do it a lot too. A lot of my clients, it came through the CTO office, but it's definitely not in the clinical space. So when you start moving into clinical operations and patient care and bringing this type of technology,
Right.
do you see a change in the buyer market?
I do. So there seems to be, especially with COVID, COVID has really uncovered a lot of ills that the hospitals were having. And if anything, it's kind of sped up, you know, to where there should be investing. In the old days, you go to the hospital for just about everything. Now we have these 24-hour, you know, drive-by. We call them dock in a box.
Yeah,
you know,
right.
you just go there, you go to one of the grocery stores or CVS and get services, right? And that's kind of undercutting the hospital. So the hospital now has to figure out a way to compete in that space. And so that's why you see a lot more, especially here at HIMSS, remote patient monitoring, more telemedicine stuff. And they're really looking, how do we figure out a way to treat that patient and address the patient's needs using automation, using some of the platform and tools they already have.
It makes a lot of sense. You know, it's interesting. You were saying that during, I'd say March or April. PwC as well as Gartner did a number of reports about technology, and one of them was automation. And they said around 50 to 53% of CFOs would invest in robotic process automation over the next 3 years. And I thought that was really, really great. And of course, you know, very validating for us at that time. But then I started thinking, what about the CIOs? And I think the point you're trying to make is it's actually larger if they had surveyed the CIOs. They just don't realize that automation is what they're looking for. So I'm sure, even though it was a great statistic, because you're assuming the CFO has to write the check, the reality is they're not necessarily the entry point anymore. And the CIOs should be really thinking hard about how automation should be a part of their future plan of treating patient care.
Right. That's a good point. So when we talk to the hospitals, we're focusing. We work with the CIOs because they're always involved in decision making, but primarily what we discover the buyers are the folks on the innovation side, because they're sitting there going, you know, where are we going to be? Like you said, we have a lot of shortages. You know, all the way around.
So, Joe, I think we're coming at time, and I think we have to actually go on the floor and see some of these great conversations. You know, always trying to work them in between these meetings. But I really do appreciate you coming and seeing us today.
Well, thank you. I appreciate it.
Element Blue, a big partner of UiPath. We have a lot of niche healthcare organizations. You know, a lot of my executives that do adopt automation. The first thing they say is, "Hey, I don't have the time, I don't have the staff, but I want the automation. Give me someone that can deliver it and knows my business. So we have a lot of organizations like Element Blue who deliver just that.
Thank you.
So I really appreciate the time.
All righty.
Okay.
Thank you for your time.
Thank you.